Hello, my name's Jacinta Douglas. I'm an academic at the Trobe University in Melbourne, Victoria, and I've worked for many years as both a clinician and a researcher in the field of aphasia and aphasia therapy. I've learned a great deal from the people I've had the privilege of working with and continue to enjoy working clinically in the field. Firstly, aphasia by definition is a language problem that results when parts of the brain are damaged. And the parts of the brain that we're talking about are those parts of the brain that control or that process language information. For most people, those parts of the brain are on the left side of the brain, in the left hemisphere, because our left hemisphere is the side of the brain that is dominant or specialised in language processing. The sorts of problems that can cause damage to the brain that leads to aphasia includes things like stroke. Stroke is in fact the most frequent cause of aphasia, but also somebody who's had a tumour and had a tumour removed can experience aphasia. Sometimes somebody who's had a brain injury can experience aphasia. And depending on where the damage is and how much damage there is, a person can have particular difficulties with speaking, with using words in communication, with understanding words, with understanding what people are saying, and they may have particular difficulties with being able to read information and with being able to write things using words.
In terms of that, how does aphasia affect you? It's really probably day to day in terms of having a conversation, because sometimes you'll have trouble finding a word as such, right? So in terms of having to contribute to a conversation like we're having, it's hard when you struggle to find a word as such.
Yeah, but no, say it, but
yeah, you know what you want to say, it doesn't come out.
Yes.
So contribution to conversation
or
sometimes.
No, say it. No, right. So round the words.
You work your way around to the word.
Yes.
Sometimes you say something relates to what you're trying to say.
Yeah. And
you can work it out that way.
No, writing down. Oh no, books. No, I think little bit. No, a paper. No, little bit.
You can recognise some words.
Yes. But books. No, magazines or right. No, but no books.
You can't really read books as such. So it affects the current reading as well. As the speech.
Just everyday talking, like we take talking for granted. Now for Cass, she can understand 9 times out of 10 she can understand everything. But now she's got to either write it down on a piece of paper to get her message across. So
Yes.
Everything's in there. We just
Can't get it out.
Yep.
Yes.
When you first experience aphasia, for the person with aphasia, it's very frustrating. And it's also frustrating for the people that they talk with, because things aren't the same. Somebody who was very used to being able to talk easily and communicate well is now having difficulties. Those difficulties might be severe or they might be mild. Even if they're mild, they can feel very frustrating for the person who's experiencing them.
Basically, you don't know when you are going to be able to express yourself. You go somewhere and you think, what am I going to say? What am I going to do? At the beginning it was really awful, because I would think, okay, I've got to say to this person, I want some oranges. And I couldn't think. I'd be looking at the orange and I'd think, I want some of those. But I couldn't think what the orange was. I was always very articulate, and suddenly I had nothing.
There's a lot of frustration, but we've both gotten better at it, and very rarely, there's still frustration. But it's rare now. It's just a lot of contentment most of the time. People with aphasia may experience other difficulties associated with damage to the brain that are not related to aphasia. Dysarthria is a weakness of the muscles in the head and neck, including the muscles we use for speech and breathing. People with dysarthria may have speech that is difficult to understand. Apraxia is a difficulty planning and coordinating movement. People with apraxia may have difficulty making different facial movements and movements for speech. Apraxia is also known as dyspraxia. Dysphagia is a swallowing difficulty. People with dysphagia may find it hard to swallow food and drink, as well as medications and saliva.
It's really important to remember that aphasia is a problem with using and understanding language. Okay? It's not a problem with intelligence. So the person is the same person. The person has exactly the same intelligence as they did before they experienced aphasia. The other important thing that's really necessary to hold on to and to think about is that aphasia doesn't stay the same. It changes over time. It can start off very severe, and over time, because our brain recovers and our brain changes, the more we use language and the more we attempt to communicate with people, we often actually have changes in how our brain is organised. So it actually gets significantly changed and improved over time.
I suppose what you would say is it gets better, really.
Yeah.
You might not get back to where you were before the stroke, or before you had aphasia as such, but time fixes a lot of it. You do improve a lot.
Slowly, I think words and coffee or tea and slowly I think is good, but slowly, yeah.
There has been a gradual increase in the ability to communicate, talk. And it's very tiny, but I guess when I'm 150, I'll be perfect.
The stroke is a rapid change or loss of blood supply to an area of the brain. And that loss of blood supply can be due to either a hemorrhage, where a blood vessel bursts and the area around that blood vessel is damaged, or it can be due to blockage in a blood vessel in the brain, whereby a clot gets stuck in a blood vessel and stops the blood from reaching areas beyond that point where the clot occurs. Both mechanisms lead to the surrounding brain tissue being starved of its nutrients, being starved of oxygen and glucose. So that surrounding brain tissue is actually damaged. And that damage then can lead to the problems that we know of as aphasia. The will I get better question is such an important question because it's the first thing that anybody thinks of when they've had the really difficult situation of having some sort of a medical problem that leads to aphasia. We know without doubt that there is change over time, that the way a person is from the first day to 3 months later, to 6 months later, to 12 months later is going to change, and that change is going to be in a positive direction. Furthermore, what's really important also to remember is that change doesn't stop after a definite period of time. We know that people continue to make positive change in the way they're able to go about their lives every day, the way they're able to participate in society for many, many years after they've had a stroke or after they've had some sort of medical problem that's led to aphasia. So the bottom line is that yes, there is positive change over time, We don't know exactly how fast it's going to be, and we don't know exactly how much it's going to be, but there will be positive change. Now, when we actually look at what we know about how people do change and how they change and how quickly they change, many factors have been identified in our research and been identified when we talk to people who have experienced aphasia. Motivation can make a very big difference in how much you can expect to change, how much support you have around you, the sorts of supports you have with respect to your family and your friends can make a difference as to how much you can expect to change. Other important issues are how severe the stroke was, how much of the brain was actually damaged, and what your general medical health is like, how well you are, how many other problems that you might be having. Other things that are important are issues around a sense of being active. The more active somebody is, often the more change they can expect to experience. And perhaps I should say, as a speech pathologist, the other really important thing that we know makes a difference is whether or not you receive therapy and how long you receive therapy for. We know that therapy makes a difference. We know it can help you not only change language ability, but it can help you to adjust to experiencing those changes. Frequently I'm asked the question, is learning language again after having had a stroke, is it going to be like learning to speak as a child? No, it's not like learning to speak as a child. The really important thing to remember here is that it's language that has changed. It's not your ability to problem solve, it's not your intelligence. So you have all of the knowledge, intelligence that you had before you had your stroke. And what's important when you're learning after you've had a stroke and you're dealing with aphasia is that we capitalise on your strengths, on the abilities that the person still has, and we build on those strengths so that it is not starting from scratch. You will have a lot of knowledge already about language. And what we need to be able to do is to maximise your ability to use that language. You haven't forgotten all of the rules. You have difficulty accessing them sometimes, or being able to retrieve them from your memory store. Finding the right word we describe as being word finding, not surprisingly. And finding the right word is a difficulty that almost everybody who experiences aphasia has some encounters with. It's important to remember too that even as we get older, whether we have aphasia or not, we're going to have some difficulties finding the right word. Why do we have that difficulty? You can have that difficulty for several reasons. But for most people with aphasia, the word or the knowledge of that concept is not lost. They know what the word is they're looking for. It's best thought of as a retrieval, of a going back in there and finding the right word and bringing it out of a really large storage system, and not quite having the right index, if you like, or the right features to look for. So you might have difficulties finding it, but you might find a word that's close to it. Or you might have difficulties with that sense of, oh, I know the sounds, but I can't quite find the right sound. So it's a retrieval problem rather than a loss problem. Frequently, people are frustrated because they actually say something and they are clearly saying a message they want to get across, but the person they're talking to doesn't understand them or doesn't understand what they're saying. Between having an idea of what the message is we want to give to somebody and actually saying that message, there are many stages that we go through. There are many stages that we work through in being able to say that message. The first thing we have to do is find the right words to express the ideas. we've got the ideas, we want to express those in words. You might be wanting to talk about, for example, your family pet, and instead of saying that you have a cheeky dog, you end up saying you have a cheeky cat. That is, you get a word that's really closely related, but it's not exactly the right word. That could confuse people. Then they think that you have an animal you don't have. Sometimes, even when you find the right word, so you've been able to find the word that you were looking for, you've been able to say that yes, I have a dog, in terms of understanding what the meaning is, but when you go to pronounce it, the wrong sounds come out. So it might come out as, I have a doll, which would confuse somebody again. And sometimes when you put the sounds with a word, completely different sounds are, if you like, activated, or they're actually accessed for that word, and a completely unrelated word like agent or piddlin, not even a real word, can come out, and that can be very confusing. All the way through the process, you've known the idea you want to express, but there's breakdown at different levels so that different errors occur, and people get very confused. You're still very aware, though, of the message that you wanted to get across, and that's where the frustration can come up. Issues around repeating the same word over and over again can be really frustrating for people with aphasia. And again, it's a sign or a symptom of where the breakdown is occurring in the language processing system or in the brain. We get stuck on things. When the brain has been damaged, when the language system isn't working properly, instead of a new word being activated, the same word comes out. So I might want to, instead of saying a word like fork, I want to move on to saying a word like spoon, but when I go to say the word spoon, I say the word fork. And then I might want to actually move on to a word like knife, and I still say the word fork. Another surprising outcome for people with aphasia is when a person who hasn't sworn before very much, is very polite and has extremely good manners, finds themselves swearing. And in fact, the swear words are the words that come out more easily than any other words that they want to say. The reason for this happening is because swear words are actually automatic words. They're stored much more automatically for us, and they're much more easy for us to access. So even though you have a language problem, frustratingly enough, the words that are often the easiest to say are swear words, or the words that are automatic. And if a word is automatic, it is much less likely to be impaired by the brain damage that has led to the aphasia. It doesn't mean that you've lost your manners, it doesn't mean that you're impolite, it means that the automatic word is jumping out when you don't want it to.
For more information about aphasia and local support groups, contact the Australian Aphasia Association. Their website is www.aphasia.org.au